Hello. Yeah. See, there are a few things that one has to be very careful about when you are having any kind of symptoms or recurring symptoms, like then instead of taking any kind of medications by yourself and or following any of the TV or YouTube videos and things like that and doing medications by yourself, make sure you get clarity on the problem. Okay, first of all, with a proper practitioner. Okay, otherwise what happens is lot of things start piling up, and because of unrelevant medications, that's exactly what happens over in years of practice. I've seen that. That's why I say it may look that it is not I mean, it is matching very well and things like that. You may feel a little better and things like that, but that would not be the case usually. So get yourself have clarity on it, and then only you have to go to the next step. Okay, don't think that I didn't have it, now it has come, because the progression of a disease happens in different ways, and you might not be aware of what is happening in the body, but then when it just comes out, then you will think that it has come suddenly. It is not like that. See, the evening doesn't happen, the night doesn't happen suddenly, right? It is not like a switch from morning. It is a process that it takes, and it happens, and then when it happens completely, then you understand that it is night. Just like that, there is a process where the disease sets in. Okay, that's why you will not be able to know whether it is a major issue that is showing up, or it is something like instant, like there is some fever that comes today and then you take a medicine and it goes away. That is, those are two different things, right? If it is cold also, sometimes the cold might be a symptom of a very latent disorder, so you have to be very careful about it. So I recently came across a few cases wherein they thought that they had some problems. For that they had to go in for counseling, and then they would feel better and things like that. But when I noticed it, there was a major issue that was going on, which was actually the base was life threatening. Okay, there was benign growth that was there, and then of course right now the things are going, and then the investigations are going on and things like that. That's why I make it a point to tell that please do not ignore these things. These are not fun, and without understanding, how can anybody take medicine? I mean, that is what is a fascinating thing for me when I see. Okay, so one more thing is that I have designed the program wherein you can actually contact us and take the you can discuss your case and get clarity. That those are actually paid programs, and it's a very nominal paid programs, because we do not want like 100 people just talking and all those things. And yeah, I've seen it long a lot of times. So if you think that you are going through something, you need to have clarity, please get in touch with us, and then get into that at least the discussion part. Then you can decide what you want to do, because your life is valuable, and the health is something, when it reaches a point of no return, then you won't be able to do anything at all other than taking medicines, or going into surgeries, or it might be life threatening as well. See, diseases does not say and give notice before coming. Okay, so and any choosing any kind of things, so many people. There was one person who actually was asking for diabetes, can you teach yoga? Okay, then I had told him that for just for diabetes yoga, that wouldn't be the right thing to do. You have to see what exactly is going on, what are the other things that is going on and all, and then see, some things happen. So I mean, it was very unfortunate. After a few months, I think he was confused or something. We never know. He was on medicines and things like that. But then he never came back after that. And then I knew him, and then I got to know that he actually was trying to water in his new construction, and then the water and electricity got in, and then he passed on. And see, mind will not be clear when there is a problem, when the health is going through issues. People can have various kind of problems. That's why I say, when see, water and electricity both together is going to give problems, right? We all know that. And why would he do that? I have been so sad about it. See, people will think that diabetes and BP are some different things and you can take medicines and get it. But the point is, these are chronic issues that can actually manipulate you, the way you think, the way you understand, the way you see the world. You know, it's like a glasses. And then these are not diseases by itself, but they actually indicate something that is happening inside of the body in a deeper sense. And most of the places, like, you know, in most of the sciences, they have their own way of treating, and people say that I have this one, that one, I have the BP, I have diabetes, I have hypothyroidism and kidney issues and all those things separately, and they want to take medicine. And does a human body have separate things like that? Is there no interaction with those organs or the things? I have to tell that most of the people who are in the medicine field also have forgotten these aspects. Maybe for whatever reason, I do not know. But with me, it is not the case. So, in case you want to get yourself and get clear with what is happening in you, please go ahead and then contact us, and then fix up your appointments. So, it would be worth the money. Okay, you will have more value than whatever that you can think of. All right, be safe. That's what we want. See ya. Bye bye.